Hi everybody, my name is Lilian, Mumina. I'm a clinical nutritionist and welcome to my YouTube channel. Today I want us to discuss the possible dangers of going beyond your expected delivery date during pregnancy. So what does it mean when someone tells you you've gone your postpartum or you're having a post-mature pregnancy? This is basically a pregnancy that goes beyond 42 weeks. So the normal pregnancy term should be between 38 to 42 weeks. So anything that goes beyond 42 weeks is considered postpartum. Anything that goes below 38 weeks is considered preterm. Preterm has been talked about. It is basically associated with several conditions such as low birth weight, delayed milestone, malnutrition, and even if in severity there's fatality, there's death, and all those long-term complications. How do you know that you've gone postpartum? As I've said, you understand that you've gone postpartum if your pregnancy goes beyond 42 weeks. This can be done through calculating your EDD. The most accurate way is by getting the last day of your menses, whereby if the pregnancy has gone above 294 days, then it is considered postpartum. Unfortunately, we rely on memory on this because ultrasounds can be a bit deceiving. Unfortunately, in Kenya and in Africa, the health-seeking behavior of a pregnant woman, even when you're pregnant, someone will just tell you, unaanza clinic mapema, una kierere sana. People, you'll hear women talking about another woman saying that akona kierere sana because of going to clinic early. So you find that most women will only start going to the clinic when the pregnancy starts to show, or it's about 4 to 5 months, which is not so good because we want to be as accurate as we can in terms of date. And again, going to ANC, the antenatal clinics early, is very, very beneficial because you get the supplementation that are needed. You can have the tests done. If let's say the infection, the STIs, the HIV, and all that. There's so many concerns that can be addressed with going to the clinic early. So if you're pregnant, or if you discover that you're pregnant, please start your ANC clinic as soon as possible. It is necessary, it is important, it is preventive, because most of the complications that occur in most women are basically preventable with a good nutrition, proper care during pregnancy, and proper care during the delivery. So also, when this story of women giving birth at home, avoiding the clinics, fortunately for us, the government waived most of the charges in terms of delivery. There's free delivery in public hospitals. If you have an NHIF card, please go to the clinic. Go registered as Linda Mama. Start going for your clinics in the public hospital. It is available. We have trained doctors, we have trained nurses, we have trained nutritionists. All are available, so make sure that you go and seek these professional services there. They are free. And if you're here and you're looking for the dietitian to walk you through, we also do that at Mumina Wellness. We take care of your pregnancy needs, we take care of your infants, we take care of your weaning plans and all that. We have a care plan for pregnant, lactating, and weaning mom. So talk to us. We'll be more than glad to do that. So what are some of the complications that are associated with having a postpartum pregnancy? So this is basically, as I've said, this is basically a baby that is born after the 42nd week of pregnancy. That is basically after the 294 days from the last day of the period. So one of them is having a macrosomic babies. So having a macrosomic babies or infants or fetus is basically big babies. A baby that is born and they weigh above 4 kgs. Of course, when you go to a hospital and see a baby that has been born with us, they look so cute, they look so chubby, they look so fluffy and healthy and all that. But is that really the case? No. A baby that is born of the normal, the expected ideal weight, of an infant or a newborn is supposed to be anything between 2.5 to 3.5. So anything that is above 4 kgs is considered a big baby. So there, of course, there are other conditions that predispose a woman to have a macrosomic babies apart from post-date thing. If you as a woman, you were obese before you got pregnant, if you as a woman, if you had diabetes or you got gestational diabetes during pregnancy, and also if you gain the excess weight. I did a video on nutrition and pregnancy where I talked about the nutrients and weight gain charts in pregnancy. I'll link it up. If you gain the excess weight again, you're predisposing yourself to having a macrosomic baby. A macrosomic baby is not so good because it predisposes the baby to metabolic disorders later on in life. A baby that is born big, studies have indicated they are more prone to being obese in adulthood. They are more prone to having metabolic disorders such as type 2 diabetes, the hypertension, liver diseases, all those, more than the babies who are born in normal the average normal weight. So you want to make sure that you avoid this as much as possible. And also, apart from that, you as a woman, when you're having a macrosomic baby or a big baby, you're also predisposing yourself to tears and ruptures during delivery if you opt for vaginal birth. And again, it increases your chances of CS. You get that women who are going to have big babies, most of them end up doing C-section. I'm not saying C-section birth is bad, but if you can avoid it, why not? Vaginal birth is not the easiest, but it is the most natural way of giving birth. But again, if there are complications that will prevent you from having a vaginal birth, do not hesitate to do the C-section, because at the end of the day, regardless of the birth methods, what you want to have is a healthy mama and a healthy baby. Apart from the macrosomic baby, the second complication that you can have when you have a post-date pregnancy is the baby getting birth asphyxia. Basically, fetal asphyxia, or the fetus lacking enough oxygen supply. There is reduced supply in terms of oxygen because of the function, the placental functions have reduced, so the circulation also reduced. After the 42nd week, now the body is ready to expel and you've not expelled. So all this, they can limit the oxygen getting to the baby. So what does this do? This can have severe effects, serious complications that might affect the baby for a long term. So one of the complications that is associated with birth asphyxia or lacking oxygen is, one, the baby can get cerebral palsy, the baby can be epileptic. These are some of the serious complications. You can get the autism spectrum disorders, there's the delayed milestone. Apart from that, the baby can have severe damage to the brain, and this, when your brain is damaged a lot, like your cognitive movement, your coordination, all this, you can also get blindness, deafness, all these. Some of these small complications, they're not so small as you think about it. You may just think it's a normal thing to get to 43 to 44 weeks. It's not so normal. So just make sure that you talk to your doctor or your physician, or you go to the nearest hospital and get your concerns addressed, because it is not normal. It is happening so much in African countries, or in Kenya in particular, because of I don't want to say ignorant, but it is basically one of the main reasons, because most women, like, we are glad for the county devolutions and all that, because we have like the hospitals being well furnished and well equipped in terms of equipment and medical practitioners, though a lot still needs to be done, but it is better than it was before. So health seeking behavior, women can access maternal care even in their rural areas. You don't have to travel all the way as it was maybe in the recent past or something. We need to encourage more women to make sure that they are going to the hospital for clinics, they are going for ANC and all that, so that we also get the woman or the expectant mom on board as you count the days, so that she knows when she's supposed to be expecting and all that. Again, to prevent some of these complications, because they can be really fatal. Of course, there are other factors apart from maybe postpartum that can predispose a baby to birth asphyxia or to fetal asphyxia, and we have like prolonged labor, we have like difficult labor, we have infections during pregnancy. If you're pregnant and you have STDs, STIs, or even at birth, all these can predispose a baby to get less oxygen. But if you're anemic, again, I talk about nutrition and going to the clinic when you discover, because a lot of studies report of a good nutrition having a positive outcome in pregnancy. So please, you cannot undermine nutrition, you should not undermine it. And also pregnancy care during pregnancy, so you should not be undermining it too. So make sure that you're taking care of this, taking care of the baby, taking care of yourself, and keeping a track of the dates, of your progress, of your weight and all that, to see the weight chart. But again, do not obsess over some small tiny things like weight, but again, you want to make sure that you're gaining the good weight during pregnancy that is needed for the development and the growth of the baby. Apart from birth asphyxia, you can also have meconium aspirations, basically whereby the baby gets a mix of the fluids and the meconium, so in their respiratory and in their lungs, and this they can predispose the baby to pneumonia and pulmonary hypertension. If well managed, functioning can be done whereby they are being they're being sucked out, those fluids and all this, they're being sucked out from the baby's lungs. And also in treatment for if the baby gets infection, maybe from pneumonia, treatment should be administered. We have the meconium staining, whereby you get the baby has small complication, like maybe they have on their skin, there's the meconium, maybe black or green depending on the days that it has been there. Then their skin can also appear wrinkled and old due to maybe dehydration and all that. The baby can appear weak, all lethargic and all that. So make sure that you take care of that. You can also get jaundice because of the excess stain in the stomach for long. So yeah, we want to avoid all this because it is not necessary. And then there's also the long-term complications, whereby we have disabilities, we have delayed milestones, we have cerebral palsy, I've talked about it, we have autism spectrum disorders, we have mental disorders like psychosis in adulthood, we have ADH in adulthood, we have post-traumatic like childbirth trauma from the mom. There's also the excess rupturing and all that. We need to take to ensure that when you're taking care of your health, you're taking care of your dates, you're going for your clinics well, and you are on the right track. And if you have any concerns about your delivery time and delivery period and all that, make sure that you talk to your general practitioner, you talk to your physician, you talk to your gynecologist. You just go to a hospital and address your concerns, have your concerns addressed, because it is important, it is necessary to promote a healthy outcome. At the end of the day, what we want is a healthy baby and a healthy mama, and reduce infant mortality and also reduce maternal mortality rates, which unfortunately are still high. And yeah, one of the ways that we will attain the goals is educating and getting this information to a mom. And thank you for watching. And if you're a new mom, congratulations. If you're pregnant, congratulations. If you know a new mom, share so that they can learn a thing or two. And thank you for listening. Bye.